Hey guys, Anya here again with Companion Health for part 2 of stress. So, question being, is stress actually making you dumber? So as stress increases, there's an increase in something called your sympathetic nervous system. This is the part of the nervous system that is responsible for raising your heart rate and raising your blood pressure. A lot of you have probably heard of fight or flight. So the sympathetic nervous system is the fight and flight part. And then there's another part of your nervous system called the parasympathetic nervous system. This is that rest and digest. So the body constantly tries to balance this sympathetic and this parasympathetic nervous system. There's actually something called HRV, which is heart rate variability. This is actually measuring the balance between the sympathetic nervous system and the parasympathetic nervous system. So the higher your HRV is, the more imbalanced they are. So what ends up happening with stress, as stress increases, like we talked about last time, cortisol is increasing. So when your cortisol increases, there's something called a cortisol curve that we look at. And when that cortisol curve is higher, there's actually an upregulation in your immune system. So if you've ever noticed when you're more stressed out, you feel like you're getting sick all the time, this is why. It's your body's protective mechanism in response to all these different things coming at you. So you also can see more rashes happen, more allergies. So if you've noticed that you're getting more food sensitivities out of nowhere, this is probably because your cortisol has been elevated and has been elevated for a longer period of time. You can also see asthma worsen. In general, there's an increase in something called a histamine response. Prolonged exposure to elevated cortisol levels can affect your brain. So you can actually see the brain start to break down. So we talked about in the last video that cortisol is something called a catabolic hormone, which means it breaks things down. So over time, you can see a degeneration in a part of your brain called the hippocampus. The hippocampus has the most cortisol receptors, so this is why you see more of an effect there. The hippocampus is primarily responsible for memory. So if you feel like you can't remember anything anymore, more brain fog, it could possibly be due to these chronically elevated levels of cortisol. Some other parts of the brain that these elevated levels of cortisol can affect is your hypothalamus. So you can see this in chronic fatigue syndrome, fibromyalgia, depression. This is treatment-resistant depression, meaning that you feel like you've been on all the medications or you're increasing doses and it's just not doing anything. You can also see PTSD. You can see some changes in the hypothalamus secondary to this cortisol level being elevated. Your prefrontal cortex is responsible for executive decision making. So if you feel like you're having more difficulty with that, task management, some of that, it's potentially because of cortisol. And then a part of your brain called the amygdala, which is responsible for emotional stability. So you feel like you're more irritable, more emotional, things like that. Again, could be potentially responsible to chronically elevated levels of cortisol. Eventually, you can go into a state of hypocortisolism. So you can get what's called a low and flat cortisol curve. This is actually your body's way of protecting your brain and protecting some of the other tissues in your body. The cortisol, when it's elevated, again, it's breaking tissues down, and your brain's like, well, we need to save ourselves. We need to stop getting eaten away at by this cortisol. So it just kind of blocks itself off, and it stops responding to some of these signals, and so you end up producing less cortisol in the adrenal glands. You can start to see changes throughout the entire body as a result of this. So in regards to the immune system, now it's kind of at a point where it's essentially unregulated. So this is when we can start to see autoimmune disorders start to trigger when they were never really an issue before. All of a sudden now some of these potentially gene mutations that were there are now getting triggered and autoimmune disorders are happening. You can also see an increase in insulin resistance. This has to do with cortisol's effect on blood sugar, hypertension or higher blood sugar. You can also see elevated inflammatory markers. And then you can see cardiovascular disease primarily through the function of something called endothelial dysfunction. So we'll get into next video is actually how cortisol can have its effect on your thyroid gland. So if you're tired and you're seeing some hair changes, it's not always your thyroid. You always need to check your cortisol. Hope this helps. Let me know if you have any questions, guys.